A couple things that really stood out to me. A quarter of Black adults that were in this survey that was conducted this year said that they would prefer to only receive care from a Black doctor. And 28% of those folks that were in that poll would prefer to have a Black doctor if they've never been treated by a doctor before. The difficulty in that is only 5% of doctors in the United States are Black. So that could cause some challenges. And I will share this data again. Also, one thing that stood out as we were kind of thinking about having this conversation is that 7 out of 10 African Americans say the healthcare system treats people unfairly by race very often or somewhat often. And that is an increase from let Tango and Grace give any feedback about why it's important. But just to give you the particulars of this survey that we are working on, that we hope that people in Rockingham County and others that are Black. I mean, this survey definitely is reserved for Black Americans. The survey definitely will, if you take the survey, you are not a Black American, the survey will know that because it will ask you your background. We are keenly concerned on getting some information about medical mistrust in the community for Black Americans. Two brilliant students from UNC School of Nursing have decided to partner with us, and they specifically wanted to do their master's project in a rural community. And one of those students is here. And I will let Grace stop my sharing of screen and go ahead and let Grace, you speak, and Tango, if there's anything you want to add about this survey. Again, we will put the information on how you take the survey on our Facebook page, in this chat. If you want to put your email in the chat, we will send you an email with the survey and more information on it. It is very detailed. It's on the 21 questions. Basically, this is the link like we'll share. You can start the survey and stop it at any time. You have to be 18 years old. We would prefer the folks that take the survey are Black Americans, and we also would prefer that you are 18 years old to participate. If you're not 18, then you can save your time if you're not at least 18, you can save your time on that. So I'm going to stop because I just talked a whole bunch. And I'm going to let Grace and Tango take the mic and share anything they would like to about why this survey is important and why we're doing it. And Sheila, if you want to say anything too, you're definitely welcome to, but we definitely want to make sure that we have this opportunity to get in front of as many people as we can. All right, I'm gonna stop talking.
So do you want me to
talk to you first?
Okay. Good evening, everyone. Thank you so much for providing this platform for us to introduce our project. The other students could not make it this evening. As Meryl said, the reason for this survey is to study medical mistrust in underserved communities, and we were interested in Rockingham County because it's one of the states, one of the county in the state where there are so many Black or African Americans who have great medical issues compared to the state average. So what we're going to do, we are going to identify the barriers to accessing this health information in this county, and also explore why there's this mistrust. As we know, especially with COVID, there's so much literature out there that African Americans do not they don't get screening for diseases like breast cancer or colon cancer, and they have the highest rate of heart diseases. So this is one of the reasons how we felt very compelled to look into medical mistrust in this county, and hopefully we'll come up with great data that it can later on be developed and into a model that can be applied into that county, and not only to that county, but also other counties or other places in the United States, even out in the United States. So we are very excited, and as Meryl said, the participants have to be 18 years of age. You have to live or work in Rockingham Rockingham County. The email should be going out. If you haven't received it, they'll be sent out. There's a link into that email. We'll be able to answer the questions. They're very simple to answer, and there are also comment section. You can add a comment if you want to add anything. And we are looking at having those the survey maybe wrapping up by end of February, because we have to compile that data and synthesize information and come up with recommendations. So we kindly ask you to please share this information. We want as many people as you can get to participate, so we can get a great data. However, we are not going to be able to come up with those recommendations right away, because this is a project for us. We are not going to be developing, we're not going to be implementing the recommendations that we're going to make. However, we hope some of the students, maybe next year, someone might take over the project and develop it into a model that can then implement it and see whether it works or not. So we appreciate your time, and hopefully we'll come up with something that's going to be helpful to that county.
Thank you so much, Grace. I really appreciate that. Tega?
Hey, Meryl and Grace pretty much covered it, but I'm the grants manager at Regional Area Foundation, and we were really interested in partnering with NC100 and UNC Nursing to get this survey out, because health and wellness is one of our priority areas, and equity is one of our values, and so we really want to look at these health disparities. This survey will help us identify areas of mistrust and barriers that are there. And as Grace said, this is kind of a first step, and hopefully there'll be more UNC nursing students who will come along and help develop, help us implement change. But you guys are really a huge part of just the information that we need. So not only can you take the survey, but please feel free to share it with anyone in your network. You can share it individually. It doesn't have to come through some organization. Give it to your family, your friends, your cousins, mom and them, and let them take the survey as well. And I do want to say that our executive director is here, Dawn Charaba, and I appreciate her being here and really highlighting the importance of this work. And also Adam Scholl is here. He is on the leadership team for the Racial Equity Learning Community. And he will be reporting back to our group about, this meeting, and also sharing the survey within our group. And all of you are welcome to come be a part of that as well.
Thank you so much, Tango. Sheila, did you want to share anything, or?
Not really. I was here to support Grace as her co-advisor, but also I decided to join because I'm really interested in this whole concept of community work and community agencies trying to decrease health disparities and starting at the ground level to really identify what the issue is and how we can move forward, especially coming from a rural area, small rural area myself. So I really came because I was just really interested in what you all are going to do. And it sounds like you have a lot of good organizations moving forward. And I appreciate you working with Grace and Rita a lot. So I'm coming for my own informational purposes and education, as well as to support their work. Thank you so much.
All right, thank you. So now, folks, we are going to go into the interactive part. So we just told you about the survey. You know how to share it. You know how to get to us if for some reason that you have questions. Like I said, this will go on our Facebook page or on our website. We hope our partners will share it. And also, if there are folks that would like to take the survey and it is difficult for them to be able to do it in this fashion, with via the internet, or broadband is an issue, you also can reach out to us. And I'll put also in the chat before we leave how to get in touch with NC100. There is a way to be able to give that feedback on the survey instead of through the internet, just via telephone call. And I think, if I'm not mistaken, Grace and Rita would be the folks that would be reaching out. We would get the contact information and let them know that there are certain folks that need to give this information via telephone, and we would get that information to them as securely as possible. And we won't be keeping any of that data, telephone numbers or anything like that. But we would. There are ways to get this information to UNC that don't involve the internet, if that's what you need. You can also. I'll also put a telephone number on how you can reach our staff at NC100 if obviously you can't send an email to say that you need it if you have issues getting to the internet. So with that being said, we're going to get to the interactive part, and I am happy to introduce and stop talking and have Adrian Hensley, who works and supports a lot of our parent coordination with our Instant Lead program, and again Mr. J. Dwayne Garnett of Love is a Parable, and they are going to have an interesting conversation that we want to be interactive about suffering in silence and other things that I think people would love to kind of chime in and talk about. So I'm going to give the floor to them and be doing technical stuff in the background. All right.
Thank you, Meryl.
Thank you, Meryl. You're going to get the slide up.
Yeah, go ahead, Danny.
So we're going to, while we're getting the slide up, we got to do, he said it's interactive. So let's see those emoticons. So if you're doing all right and you're feeling good and all of those things, can we see the hands up? Can we put the hands up? My brother Michael, he said, yeah, I'm ready to put the, yep. Okay, everybody's doing good and feeling good, because when we're talking about healthcare, the one thing that they always ask, I remember when they transitioned over to the smiley faces, and they were saying, okay, tell us your pain level from 1 to 10, and it was different types of emoticons. And so as funny as that may seem, but it was, sometimes you can't describe how you feel, but you definitely can point to a face and say, I'm in between meh and So those things really help. So we want to definitely have a conversation. Adrian and I, it seemed like we're just like the dynamic duo. It seemed like we're having these conversations about shedding light together quite often on certain different value misalignments. I love it as well. So let's talk about some of those concerns and look at, we had some of the numbers presented in the beginning with the introduction, but now we want to look at something at a more granular level to see how we feel about it. And this is an opportunity for us to engage in an open conversation. So before we start, Adrian, you have anything?
I just wanted to say that I definitely agree with Jay here. We definitely want to keep the dialogue open, and so we don't want to just be the only one speaking. I do love to hear myself talk sometimes, but I love to hear other people talk as well. So as we're going along, if there's something that we say that you really want to chime in on, please feel free to just say what you need to say. It's not like a school session where you don't have to type it in the chat. We really do want to hear your voices.
And I would be remiss if I didn't mention that my lovely wife is on, Lolita Garnett, who's the co-founder of Love is a Parable, along with our CFO, Kirsten, as well, who make part of the leadership team of Love is a Parable. So I'm excited. So without further ado, Meryl, roll that beautiful bean footage. Okay, so here's a quote from the American Bar organization. Black people simply are not receiving the same quality of healthcare that their white counterparts receive. What are your thoughts? Do you agree with it? Do you disagree with it? What are your feelings about it? Do you feel like that's old news, or is that something that we're really dealing with today? Show of hands if you have anything to say about it. Okay.
Well, here I go.
Yes, ma'am.
Okay. Yes, it is. It is old news, but yes.
Okay, sorry about that.
You hear me? Okay, no problem. This is old news, but yes, we continue to deal with this today.
And it's so important that you talk about that, because we are going to look back at this to realize that sometimes people think that certain things are buried in the past, but our past literally lays the foundation for not only our future, but the current times that we're living in. Next slide. So let's talk about some of these. Some of these you may have heard before. The Tuskegee Experiment, or the Aversion Project, or the Guatemalan STD study, Agent Orange Experiment, and the irradiation of Black cancer patients. These are actually, yes, sir, Essence? We are jamming over there. Okay. Okay. Party time. So these are some of the experiments. Have anybody ever heard of these experiments before?
This is Janet Barnes, and I have, and unfortunately, because of these type of experiments in the past, our people are going to be reluctant about taking the vaccine.
Correct.
Right.
We lost you, Mary.
It's definitely one of the reasons why there's a distrust between the Black community and the healthcare industry now, which is one of the reasons for the name, the way we put it on the flyer. These things are definitely going to have all African Americans a little weary of all things medical.
And again, this is Janet Barnes, and I looked at the snapshot for Rockingham County, and I'm not from Rockingham County, but I've done a lot of work with people in Rockingham County. You know, when we look at the population, and only 10% of the people do not have health insurance, and then we look at the income and our demographics, I think that plays a large part of it, because one, they don't want to answer questions to get the services that's available to them that they could possibly get. So they don't have the medical insurance, but for 10.2% of Rockingham County, you're talking about 92,000 residents. There's a lot of people without health insurance.
Agreed.
We lost you a little bit, Meryl. But it's fine. Let me see.
Oh, 1 second. So I need to go to the next page.
Well, no, it's something is going on with the screen.
So now?
Something is going on with the screen that's red.
Let's see what's going on here.
Let me do it this
What's
way.
going on here?
They don't have the capacity or capability.
I do. We're having some difficulty. It looks like we have some difficulty with a couple of rooms.
It's okay. I take it. While you get the sound together, I can take over this portion of it.
Yeah, looks like we had a couple of bombs in here.
Mm-hmm.
Okay.
All right, we're back.
So everybody see everything okay now?
Can you
Awesome.
share it? Yeah, you might want to share yourself, and that way I can.
I am
place
sharing
things
it.
on the room.
I'm sharing it.
Good.
Everybody see the screen okay?
Yeah, you're not in presenter mode.
You said I'm not in presenter mode?
You're in, hold on. Go ahead, hit play on your slideshow so we can see if it's.
What do you see?
Blue.
Blue screen.
That's so funny.
Yeah, the same. It was doing something weird to me too. Like when it went red.
Let's try this. From the beginning. What about now?
We see you.
You just see me. It's not letting me share it, so it wasn't there. It was the screen. So Let me see.
I can try to share it again, but mine got stuck. So we're sorry, guys. We're zooming as best we can. You might have to look at it on your screen and just talk to it. And we may not have the benefit of seeing it.
Let me see. Share. Let me do it this way.
Well, while they're trying to fix that, I wanted to piggyback off what I'm sorry, I forgot your name, that was speaking before, talked about insurance and
Janet.
thank you, Ms. Janet. That's one of the things I also wanted to talk about tonight. 20% of the average household income for African Americans is used on the annual premium for insurance. So that's a lot. And if we don't even have the same income as our white Americans, then that's going to play a big role in if our total family is covered in health insurance, and if we're not. In 2018, the study said that African Americans average $41,000 in their household as their income, and white Americans average $70,000. So to me, that's imperative to know, because if you're only looking at a $40,000 income and 20% of that is your premium for insurance, that's just a lot. So that's going to play a role in our health as well.
In addition to that, when you look at the overall issues in the community, the rent is unaffordable to 47.5, and 21% of their income goes to rent. So they rather have a roof over their head than be healthy.
Correct.
And that's the choices that they're having to make in not only in Rockingham County, but a lot of the counties across the state. That's the choices that they're having to make.
The other thing that I don't have numbers on this, but when you lose your employment, you're losing health insurance.
Mm-hmm.
Okay, the other thing is that you're also looking at the amount of people of color that are on your disability rolls, that are trying for Social Security disability, and they have no health care.
Correct.
And a lot of them don't qualify for Medicaid. So that increases the number.
Is there anyone else? We are definitely less likely to be insured. And even when we are insured, we do not necessarily have, we don't necessarily go to a primary care physician. We may go to an urgent care or emergency room. So we're not seeing a primary care physician on a regular basis, which will definitely affect our health.
Sorry about that. I can't share it anymore. Mary, you took everything away, but I actually wanted to add to that. Like when we're talking about trust, trust is one of those things that is generational, but it's also relational. And so when we're talking about trust is also looking for someone that looked like us. We showed the statistics about that earlier, but also trust for some is based on time period. So if we look back at the time period, for instance, we talked about this Tuskegee Experiment. That was 40 years. So that was an entire generation and another generation that trust was kind of damaged. And we have people who still living out of those generations who can still tell the story. So whenever we have individuals who are still present to tell the story, that actually has more weight. Like word of mouth is still one of those things, right? So word of mouth is the number one way of marketing. That works in a positive way and that can work in a negative way. So if we're skeptical of people who don't look like us representing us and taking care of us, we are also more likely to believe those who do look like us, whether they are a physician or not. Because why? We value relationship, we value family. So here is something that a lot of people probably don't even know, even within the same race comparisons, the health factors affecting Black men and women differ. Black men succumb to many of the same causes of mortality as Black women, but the difference is more Black men die from hypertension and Alzheimer's than women.
That's interesting.
I can see the hypertension.
Who said that? Who said that they can see hypertension?
I can see why hypertension. Me, Greg.
Oh, tell me how you can see hypertension.
You can trace back in history. You know, it's stressful alone being Black in America, whether you a man or a woman. But I know myself, I'm a chef, and I used to work at an all-white country club, and I was the head chef, and I had to deal with a lot of issues and circumstances that actually literally affected my health, like my blood pressure. Like I was just, it affected my physical well-being on a day-to-day basis. I left there in 2020, January, and my health increased, has improved greatly just by leaving that job. I would get headaches, and I would try not to bring that home to my wife and kids, but it would be difficult at times. When you're not feeling good and then you're dealing with underlying situations at work, it affects you. Not saying our sisters do not go through the same thing, but as Black men, we often like to hold things in. We let our pride and our manhood not express our feelings. So we hold it in, our angers, our frustration, our stresses, we keep it in. And if you don't let it out, it's going to explode sooner or later. And it usually comes out in your health.
That's another thing that was on our flyer, suffering in silence. And I think African American men are the headliners for that. They definitely suffer in silence. And if you're experiencing problems with your blood pressure and you're stressed and you're not going to see a medical health provider, then your health problems continue, and you develop more health problems, which can lead to other issues. So it's definitely a trickle down effect.
Right.
Yeah, I definitely agree with what Greg had to say about men oftentimes holding things in, and it creates more pressure and stress, more medical issues. I have dealt with hypertension since for 14 years now. Since I had an emergency cesarean, it skyrocketed, and it's been really hard to control pretty much ever since. But all of you probably knew that. Anybody who works with me, friends with me, y'all know that already, because I share, I talk about it, and I'm comfortable with other people knowing this about me because I look at you as support. And I think sometimes Black men don't feel that they could be in their workplace, and I can tell my ED about those results and how I'm feeling, or our office manager. And we make space for each other and can, not only be professional in our office, but we can be very personal and supportive of one another. And so I think our support systems really matter. And sometimes, you just don't have enough, or there isn't a lot of trust in the environments that you are placed in. And I think having a community like this, where we can at least have an outlet to talk to one another and say, hey, I know what you're going through, I'm there too, really does in some ways help. But thanks for saying that, Greg.
I wanted to say something too on that. Just to kind of follow up on what Tanya was saying. I just had a conversation with a young man this weekend, And we were talking about Black men and the stigma of them going out and getting help through like a therapist or whatever. And some of the reasons why they don't. Some of it being, you know, the stigma of talking with a therapist, and some of it being just having money to be able to pay for that care, or having the health insurance to be able to pay for that care. And just that, you know, a lot of times because of the things that they go through, whether they are professional or whatever, a chef, what have you, a lot of times they hold all that in because they don't have the same, like women, a lot, especially with Black women, a lot of times, we do, like you said, Tango, we have that community. So we have that outlet and we can let those things out and share, and we don't hold those things in. So a lot of times by us not holding those things in, our health is not affected by it. But because Black men, a lot of times they don't have that community and they don't feel like they can talk to their peers or what have you, they don't have that sense of community. They hold things in and it affects their health.
Well, I will say, and I thank you guys for sharing that. It's funny, Tango, you went into it and you didn't even see the notes, but I'm going to share another statistic with you to kind of tie it in. And because you brought it up, but it also talked about maternal immortality and injury rates are higher for Black females. So when you started talking about, hey, I've got hypertension from a pregnancy, they actually talk about so many deaths with Black women are associated with pregnancy among any other. But I wanted to add to that because it's two parts of this problem that I see quite often. One is what we're saying is very true. And so we talk a lot about representation matters, but representation in education matters as well. Like, what do I mean by that? If we have more people of color, more Blacks who are healthcare professionals, maybe they should lead more education. Because a lot of people, including myself, I'm guilty. I will WebMD you to death, and I will go through all of WebMD and think I have all of the symptoms, and that stresses you out already. Because you're like, oh yeah, I did have an itch, and I did got a little twitch. Oh Lord, I'm dying. You know, we all have that. But having someone that you can pick up the phone that I actually know, some doctors that I do trust, and say, hey, this is what I'm experiencing. The first thing they'll say is, why don't you go get tested and then let's look at the results? Because some of it can be. The next thing is when we talk about education, most of the people who are not going to receive healthcare services is actually the working class. It's not really the poor or the rich. It's really the working class. Why? Because we're working and we feel like we don't have time, or we feel like we don't have the money. A lot of major organizations offer what is called the Employee Assistance Program. And a lot of people don't know that counseling is included in part of the Employee Assistance Program. They usually give 3 free sessions, right? And then you pay for that afterwards. But let me tell you the trick to that. You get 3 free sessions based on a certain criteria. Meaning, my wife and I did this for a year one time. I went to my 3 free sessions individually, and then guess what? We went to couples counseling, 3 free sessions, and then guess what happened? We brought the kids involved, and guess what? That's family counseling there. And then it's true, we ended up having a death in the family. And guess what? 3 free counselings of grievance as well. And before you know it, that was 12 sessions I had that I didn't have to pay for because it was part of my insurance plan.
Not to interrupt you, Jay, but Reginald had his hand up. He had a question or a comment.
Thank you. Reginald, you there?
He's muted.
I believe his question, Sean, you can jump in if you want to.
I think he has a question in the chat.
Yeah, Mike just I think his topic was, are we all treated the same biologically from a diagnostic perspective? Are we not treated biologically? I feel we are not diagnosed accurately.
And that's something that is very interesting, because a statistic that we have for that is saying that health conditions that disproportionately impact Black women, such as fibroids, receive very little government research, but also all of the research that is typically done, Black women are considered hyper invisible and poorly represented. Most of the research that is given to Black women is based off of majority non-Black women. So that's one thing. And then also, we haven't even talked about Blacks have been tested for treatment, but not seen as a result of treatment. And so those statistics is one of the things that makes us what is called hyper invisible and poorly represented when it comes to the healthcare arena as well. So to answer your question, no, there still is a huge gap with understanding what equity and equality truly look like, even as it relates to healthcare.
Dawn has her hand up.
Which,
Okay.
Okay.
And Tango, I hope you don't mind me sharing this. I just wanted to give some examples of, even just how our insurance differs. So Tango and I work for the same company. I'm probably a little fluffier than her, actually quite a bit fluffier than she is. I think we both have pretty similar medical issues, probably mine more severe than hers, and her insurance is about $200 more a month, just because she's Black. And I think people don't realize that piece of it. And I think there's a disconnect in calling out your medical provider. And Daniel will tell you, when she was going through her hypertension, that stuff, I said, why aren't you there? Why aren't they doing this? Why aren't they doing this? And really pushing her provider to make change and do things. So I think there is a disconnect in the testing, like Jay said, and the actual preventative or remedies that are issued by providers.
Thank you, Dawn.
Thank you, Dawn. We have two hands up, but I can't see.
Michael as well. Michael has his hand up.
Okay.
Yeah, how you doing? I think it is like with the medical thing, you get the insurance. Like for me, I went to the doctor when I was working for a job and I had insurance. But then there was somebody to go see another doctor about it, and I think more of how much it was going to cost, and then you don't have the money and the funds to do it. That becomes a problem too. But then when you're dealing with medical, you're like, man, they're taking all this money out of my check for insurance, for medical, and for dental. It's like, when you calculate it all up, it's like, man, I just took a whole chunk out of my check, you know what I'm saying? That now I still got to manage and pay my bills. So I think a lot of in Black communities, they look at that and like, man, that's a lot of money being taken out of my check. Now I'm not gonna do it, but you need it. And then secondly, it becomes the issue of going to the doctor and hearing the bad news. I think a lot of Black families, like my grandfather, when he was talking about COVID, he's like, no, I'm not going to the doctor because of old ways they've been taught. So they passed on down in these homes. They're like, I ain't going to the doctor because he's gonna say I got high blood pressure or this and that, So it's a scare factor too of a lot in the Black community. It becomes a generational curse that is passed on down to the next ones and the one coming along, and they see it. But then, like I said earlier, though, is that when you look at where I'm gonna take out $175 this check and like $100 or $250 the next check, you're like, God, that's $400 out my check, But if someone breaks it down to our Black community, it's like, look, you need this, then they're making a co-payment when you go to the doctor, then the follow-up, and then like I was thinking earlier, like when I go to the hospital, they say, do you have a primary doctor? A lot of Black people do not have a primary doctor. I know I don't. Not since I was 18, I didn't have a primary doctor, I still don't, but I'm going to get one this year, so I'm going to make that step this year to get what I need to be a successful Black man. I make a sense of that I got to stay healthy. Let me say that, be a healthy Black man.
And also, Michael, make sure that we connect with other people, because I'm not going to lie. I remember the very first time that I got a salaried job. Those benefits are overwhelming. And here's the other thing that we have to contend with is sometimes acting like we know what we're talking about when we really don't, especially when they give us 8 different types of plans. What is high deductible? What is this? What is that? The list goes on and on. Sometimes it's just partnering with people to figure out what is best. Meaning, is it better to get your healthcare insurance with the organization that you are employed with? Or is there some subsidiary organization that also offers healthcare that is just as great? So those are type things that can help too. And then the other thing is, even I'm guilty of this. I used to think that a checkup, an annual checkup, and a physical were the same thing, and they're totally different. You see what I mean? But I used to always say, well, I went and got my checkup, nothing is wrong, but it was in the physical. That's where we learned a little bit of things, but no one ever explained that to me. I had to learn over time. And so I think a lot of it sometimes is really figuring out, okay, what it is, because it is overwhelming, but also finding someone we trust to even talk about what type of insurance we want to take to represent us. You know what I mean? So that's one of the things that doesn't happen. And then also dental. A lot of people don't know how many things are connected just to dental. Meaning you could have headaches for years and it could be connected to a bad tooth. You could have sinus issues and it could be connected to a bad tooth. And once you get that tooth extracted, a lot of the healthcare problems are resolved where you don't have to see the general physician all the time. So it's a little bit of those things. And we do have to create an incubator of trust to not only have these dialogues about our fear and mistrust, but also have these networks to develop trust so we can connect and see, okay, what will be best for me overall. Make sense? Awesome sauce. Okay, great. You're about to say something, Adrian?
I'll wait on you.
Well, here's the next one that goes right into it. We talked about the maternal mortality and injury rates are higher for Black females in retrospect of income or education level. So it doesn't matter how much money they make. It doesn't matter what the education level is. They are seeing across the board, Black females are suffering the same. Black women are 3 to 4 times more likely to die from pregnancy-related complications than white women. Black women are also 3 to 4 times more likely to suffer from a severe disability resulting from childbirth than white women.
Infant mortality is double as well for African American children, infants, over another race.
Yep.
Well, guys, I will say I pushed my luck with this. I have 7 children. But, and I'm still here, thank God. But
yes.
Baby number 6 was really hard. And one thing I want to say, I do have 7 children, and they were all delivered by people of color. That was really important to me because of the trust. Mm-hmm. I wanted someone who valued my life and would work hard to keep me and my baby alive through that. And even when the stuff hit the fan with number 6, I had a relationship with a Black woman who happened to be my doctor, who had delivered 2 of my other children. She delivered all my sons. And I know that the connection that we had caused her to fight hard to save both of us. So it's really important to me who my caregiver is. My kids say, Mommy, you're prejudiced when it comes to doctors. And I'm like, really, call it what you want. But I have to be comfortable. It's my health. And I don't want to be second guessing how you see me and how that's going to impact whatever treatment I need.
I agree. And I think that some people who don't understand what racism truly is, they will think something like that is racist when really it's not. There is a such thing as inter-relationships and intra-relationships. And so sometimes you do have to depend on people who look like you to give you a better understanding. This is the same reason why they ask you your medical history. They're asking your medical history because there is a level of relationship there that we need to pay attention to. So if it works in the bloodline, we actually should also realize that it works in actually external relationships as well. We have some people from Facebook land making comments as well. One person said, we also absolutely must have to look at the Hollister health options, but I am sure those may not fit into the acceptable health care providers for your insurance coverage. And you have another person who said, it's not just healthcare, but yes, it affects us everywhere. Another comment is, yes, 3 times as high as our white counterparts. Thank you guys over there in Facebook land who were echoing some of the same concerns that you guys have.
I wanted to piggyback off of Tango, Jay. It was a perfect entrance for me, Tango. You're just the best.
It's like she got notes. She's like she cheated.
She gets it. So the thing is, it's statistically proven that doctors listen less to Black women and how they feel about their body and what they feel is wrong with them, less than any other gender and any other race. So there is a lack of trust there because of that. We know for ourselves how we feel, and if we're taking time out of work to come to the doctor, 9 times out of 10, there's something wrong. So I completely understand what Tango is saying by wanting to pick a doctor of her color, because we aren't listened to. As African-American women, when we go to the doctor, it's statistically proven they don't listen to what we say about how we feel or what we're feeling with our body.
Ms. Rogers had her hand up.
So I wanna just comment a couple of things. I said I was just gonna listen, but as a healthcare provider of 45, almost 46 years, I can't sit by and not speak on this topic. So I have 2 points here. I think the most important thing is to find somebody that you can trust. And research has been going on for years. When I did my doctoral dissertation way back, or when I was in graduate school, way back in the late 80s, early 90s, the state of Maryland commissioned a report on minority health. And one of the things that they truly found is that people had better outcomes if at least part of their providers were of the same race and ethnicity as they were. We find that still to be true now. But I think the most important thing is that those providers aren't available, that you find somebody you can trust. And your point, Adrienne, somebody that will listen to you. So I think we have, because we know that we don't have enough Black doctors, we don't have enough Black nurse practitioners, we don't have enough Black nurses. So I think it's really important for us to educate our communities about this is what you say when you go to the doctor, this is how you approach it. And I've always said, and if you don't know how to talk to a doctor or a healthcare provider, then find somebody that does. I don't allow my family members to go into the hospital or emergency room without my being present. And I'm talking about my sisters and when my mom was alive. The difference between how they talked to them and how they interacted with them when I was there versus when I was not there is significant. Very significant in trying to get people to listen to, like, no, my mother does not have hepatitis. She does not eat out. It is her statin medications that's making her be jaundiced and have elevated lipozyme. And the resident wanted nothing to do with hearing from me. But when the attendant came down, it was like, okay, I agree with you. I think that's probably what it is. So why did the attendant change? They were white, but they had been educated in a different type of system. They were warm and compassionate and caring, and they were willing to listen to the patient. So I think we have to do a really good job of educating our communities about this is how you enter the healthcare system, and you force people to talk to you and tell you about your healthcare, and you know what type of requests to make of them. And the other point I wanted to make is that even for those people that have health insurance, I think it was Michael was talking about how much that insurance costs and how much it costs to go to the doctor. And so healthcare providers then blame you for not having good health outcomes when they tell you, oh, we need to do an MRI And your part of that MRI is $450. So a lot of working class people can't come up with $450 on spot when you have to pay it right now. There is no payment plan for getting that MRI done if you're going to a private physician's office. ER is the way to get it done. So those are just my points, is that we have to be vigilant. We have to think about, I have a bad outcome because even though I have insurance, I can't afford to get the MRI done. So my appendix ruptures because I couldn't afford to get it done, and so they sent me back home. So I think we have to think about all of the factors and not just one or two of them. Thanks.
Thank you. We have Don and then Greg.
Well, I did have my hand up, but I'll keep it short because I know we're moving on. But I wanted to just highlight, Jay, one of the things that you said about birth outcomes. And a lot of times we don't do very good about acknowledging race and historical context when we are looking at those things. And I think we tend to say, oh, it's education level, or oh, it's income. But it's not. I mean, we have a white high school dropout has better birth outcomes than a master's or doctorate level female of color giving birth. And so it's not education, it's not income. There are multi-factors. And I think we tend to just try to isolate it into one thing as, you know, education or money, but it's not. They're all interconnected.
Agreed. Thank you for that.
I'm glad.
Greg?
Yes, I was listening to everybody, especially all the sisters or females on. And I'm actually reading a book now called Medical Archives by Harriet A. Washington. And it speaks about how the Black female has been experimented on for a long time. And the mistrust and the care of health that they get, I could see why it would be doubt and cause for concern for them to want to choose a certain health care provider. Me being a father of 4 girls, after reading this book and still reading it, I'm very weary about the healthcare system and how they're going to be treated, how it's more infant mortality among Black women. And I think when we say we don't have enough doctors, I think that's something we need to start looking at as a Black community, that we start encouraging our children to become doctors and to enter into the medical field, because ever since slavery, the Black man and the Black woman was not encouraged to reach for these types of professions. We were always taught to use our hands. Our minds was null and void. It wasn't respected. So I commend, I think the sister said she had 7 children. God bless her.
Yes.
But I commend her for using a Black doctor to birth all her children. Because both of my children, both of my girls had jaundice, and we had to fight the doctors tooth and nail for them not to give my wife a C-section. And my last child, I'll never forget it, they wanted to give a C-section. And I couldn't really figure out why, but I just didn't really want to see my wife get cut on. And I can just remember having conversations with the doctor, even when my wife wasn't around, and how they would try to talk me into it. And I'm blessed to say that both of my children had that child.
Yeah, I will. I definitely want to echo what you guys are saying. My wife and I stopped at 2 because we almost lost my wife and our youngest daughter at 24 weeks. Very similar. I actually knew when my wife was pregnant, and I knew when something wasn't right. You just know something isn't right. And to my wife's point, we both have the same master's degree in health services administration. So we worked in behavior and mental health for years, which is another underrepresented area. But one of the things that I will say is also how we look at certain things, meaning there are certain things that are true, but there are other things that can also be true as well. Meaning, for years, there's been a level of distrust, right? Doing the best that we can sometimes can put us in a worse situation if nobody ever tells us about that, right? Years we had poor diet and exercise, but that was a result of, guess what? Discrimination, racism, and so forth. It wasn't because we just picked out there and said, oh, give us the low quality foods, fried up and make it taste good. It was because we had no other option. So we have to make sure as a community of trust that we don't demonize habits that were learned out of survival, but also find a way to empower those individuals to know that there are other ways to get through and push through. Don brought up another great thing. Most of our Black men are not represented in any type of healthcare study because they're usually represented as missing, period, or in the criminal justice system. With that being said, on top of that, years through the Jim Crow, even now, there are several Blacks who are coming up missing. Several Blacks who are coming up missing. So if Blacks are coming up missing, guess what is also happening? Family history is being lost. It wasn't until my oldest was born that we learned about me and her both having sickle cell, but also we had to learn about dwarfism that runs in our family too. And if it's not controlled, that can have something that can be more morbid as well. So there are so many things we don't know. Why we don't know them? Because people are missing in the chain. And so we have to develop a trust of who we trust and also talk about that. Meaning if your birth father isn't your birth father, that's important to know as it relates to your health, not as it relates to your upbringing. But we need to find out who your birth father is so we can see what you're predisposed to. Meaning we need to know what we're up against just from the back so we'll know how to make healthier choices, even down to our blood type. So I'm definitely a fan of Ms. Rogers when she was talking about education. And these are the things that we do to combat mistrust, is become an incubator of trust, but valid education and things that we can use to impact our lives today. So I wanted to throw that out there because we do contend with multiple things, but guess what? We're fluid. Human beings are fluid. We can juggle a lot of things at one time, and it doesn't mean one thing cancels out another one. So we can know what we're dealing with, but we can still move forward by being the solution to a lot of our problems as well. Somebody else? Somebody has something?
Yeah, I wanted to mention something. Can you hear me?
Yes, ma'am.
Yeah, I was just kind of piggybacking off of you, Jay, and Michael. And actually, Essence Lifestyle, I heard he had to leave. I just read he had to leave. But, health literacy is a big thing. A lot of people are intimidated. They get this white coat syndrome as soon as they go to the doctors and everything. And I think we as a people need to start re-educating ourselves, because in order for us to trust our healthcare provider, we're going to have to trust what our beliefs are and distinguish between the myths and the truths, right? And I know that is something that I have to work on, because I remember just when I was a young girl, and my grandma, grandfather had this garden, and we would go out there and, pick butter beans, the vegetables or whatever. And my back would always hurt, and my back would really hurt. And I remember my grandma saying, and this is something to the effect of what Michael was saying, and what you were saying too, Jay, some things are they're generational and they're situational. And I remember telling my grandma, that my back was hurting, but she thought I was trying to get out of picking butter beans, but I really wasn't. My back was really hurting. And so it took maybe my junior year in high school, and at the time I was a cheerleader and everything, and so I was having these back problems. And but I wasn't equated to cheerleading and things like that, that my mom didn't know, and it wasn't her fault. She didn't know, well, maybe we need to have your back x-ray, right? So all this time I had scoliosis, didn't know. So my back was really hurting. And so my grandma kind of made me feel bad because she told me that I'm too young to have a back. I don't even have a backbone. I just have a gristle. Yeah, I don't even have a backbone. You just got a gristle. And so I just downplayed it because, you know, I don't want to seem like I was complaining or, you know, trying to seem like I was just trying to get out of something. But that made me feel like it really did. You don't have to, you know, you don't have to complain. Don't complain. Which I wasn't complaining, but you don't have to make everything be an issue, right? Because my grandmother would say, we don't go to the doctor for that. That's just straight. You just wasting your money, you know. And so we just try to just downplay it and not make it an issue when we really need to not really make it an issue, but make it a priority. An issue and a priority are two different things. And so, you know, and then, you know, with Michael saying, I remember my grandfather saying, you know, he doesn't go to the doctor. They have all of these other remedies, which were on point. They actually work. A lot of those things, I saw those make, you know, tremendous changes in, you know, health situations and things like that. But I think that's what they relied on, and they did not really want to entertain going to the doctor or seeing a doctor and things like that, because they just rely on their religion and their beliefs, and they see this happen to this family member or this community member, and things just worked out okay. But health literacy is very, very important. And one thing that I really want to mention, and I'm just so, you know, happy that we're fortunate to get a grant through KBR, and it's actually focusing on medical trust, you know, in the Black and brown communities. Because if we can just start a conversation and start having people that, and as you said earlier, that looks like us, talks like us, don't intimidate us. Because even in our own culture, we can be intimidated by somebody else's knowledge and us not having it. We won't say anything because we don't want to look like we're you know, not intelligent. So you just don't say anything. That's the worst thing you can ever do in life in any situation, is not say anything. If you don't understand, say something. So I'm hoping that with this grant and the aims that we're having, that maybe we can bring more people to understand that, hey, you're not alone. We'll have people here acting as advocates for them, so they can be a system of care, so that, and when the doctor was speaking, I know exactly what she means, because I have been with my grandmother to the doctor, and if I'm with her, the response is totally different. Not only from the doctor, it starts as soon as we walk in the office. As soon as we walk in the office, you'll get that layer, and it doesn't stop until you leave the office, or until she brings her granddaughter Katrina with her, you know. And so this is really real. And until we start looking at ourselves and looking at our own community and being advocates for ourselves and change the way we're thinking about things, you know, I think that's where we have to start there. That's where we have to start and acknowledge it's really a problem, but there's really a solution. It's really a solution. And then when Essence Lifestyle was talking about, you know, the different tests and things like that was going on, you know, within the Black and brown community, without our knowledge, even knowing that we were lab rats, so to speak. And then think about the immortal life of Henry out of Lax. And here's this lady herself just done so much for the medical community, medicine, testing and things like that, and she never got a dime. Her family never got a dime for it, but all of these tests and the outcomes and everything just changed the medical world tremendously. So yeah, I just wanted to thank you all for allowing me to be on this platform, because the information is just phenomenal. And I'm hoping that at some point, you know, somewhere down the line, we can all work together, you know, outside of the Zooms and everything, and just really, really make a difference. And I thank you all for that.
Thank you for sharing that. I definitely agree with you, and I hope we do keep this conversation going, and I do hope we put things in place to help. Tango said she too is partnering with NC100 to work on something with the mistrust in healthcare as well. But then Don came on with the baby and distracted everybody. I know that I was distracted because every time you see a cute baby, I'm like, ooh, and it's not mine. It's perfect. Meryl, we're at that quarter after the hour. Do you want to, I know you wanted to stop around 7:15, so I wanted to do a time check real quick.
Yeah, no, I just figured that maybe that would be a good time to, if we had a wrap up, but we still got time. People were expecting to stay here till 7:30, so
okay.
Yeah, so we still got a little time. And I'm not sure if there was like a part. I know there were like a couple things you wanted to go into. I don't know if you have time to do that, or maybe that could be part 2 of another conversation.
Yeah, we can definitely do part 2. And plus, Don Daily Mac want to say something, and she had the baby.
Yeah.
I brought her here for a purpose. This is my granddaughter, and
Beautiful.
I said, hey, this is a great way to break into everything. But seriously, I was listening to everything that's going on, and I am nowhere near Rockingham County. I'm in Northampton and Halifax counties, and as you can see, I'm a nurse, and I'm also a minister. And so I'm on the fine line of where do we get people to trust. And I know that education is key, and just having somebody to walk with you. We are, I think, Rural Health Work for. I think we got a grant from KBR as well, and what we're creating is like a health ambassador program, and we're getting people from the community, not the people that talk like that knows all the jargon, but ones that I understand what you're talking about, and this is what I learned. And so we're training them how to talk to people and to explain some of those basic things, because there are some things that are pretty much common across the board, and it's a poverty thing in some of our rural communities. And yes, Black people do get the raw end of everything, but I came here from Philadelphia. I realized that poverty affects everybody pretty much the same way. And so the people that I see in my clinic, I do Medicare wellness visits. So I have, poor people that are old. They have a lot of serious medical issues, and they're Black, they're white, and because they've moved here from other places, some of them are Asian, they're everything. Native Americans, they have some serious issues too. Some of theirs are even worse than ours. But the main thing is the misinformation. And I heard people talking about old remedies, and some of them really do work. And and they talk about prayer. And of course, I have to let them know I'm not just a nurse, I'm a minister. And so I believe in the power of prayer, and I believe in some of those old remedies. And it's important to find a practitioner who can meet you where you are and not discount all of those things that you believe and that have worked for you. And we got to get people to understand your body better than anybody else. You may not understand the word for what's going on, but about that ache, about that pain, and you have to be able to speak up for yourself. And so I'm really encouraged. There have been so many things COVID has done that's horrible, but then there's some opportunities that have come out of it as well, for us to have conversations such as this and to begin to address the inequities and the disparities. But I think that is in the right direction.
Thank you so much for that too. And I agree with you, because I don't care what y'all say. Ginger ale and saltines always help with an upset stomach.
Gosh, yes.
I don't care what y'all say.
I still use ginger ale.
And lay down is a form of medication. Just lay down. And close your eyes. You got to close your eyes too. We had Katrina and Michael. Okay, we had Katrina and Michael. Y'all had your hand up?
Oh, no, I would just put a thumbs up and
Okay.
just say what Dawn was saying. And Dawn, I'm originally from a Husky. Yeah, and my dad's family lived in Severn in Northampton County. Severn and Jackson. A small world.
Yes, ma'am.
So here's another one that we can dive right into to kind of close us on out. Paradoxically, where Black men are visible, is in the criminal justice system, and they are increasingly having fatal encounters with police officers while remaining invisible in research and policies aimed at improving their health. So if we even think about recent events, there was a brother who was in crisis, medical crisis, and his brother called the cops to get his brother treatment, which led to a fatal incident. So when we talk about trust, some people are leery of even calling for support for someone that they know may be in crises or may have a need because of more fatal outcomes. So how do we overcome those? You beat me to it, Meryl. Thank you. You got something, Michael? Or you just saying thumbs up, you agree?
Yeah, I think sometimes I gotta talk with the chief of Reedsville about just getting out into our community before they're called to a situation. You need to get out and meet and greet these neighborhoods before someone called and say, I need 911 out here. Because you gotta build a trust with your community. Y'all understand what I'm saying? Not just when they see the police car ride through the neighborhood, first thing the kids say, oh, that's the bad guy. That's all mom and daddy tell them. But if you get out and meet and greet these people, they accept you more. Like you were stating, like this guy had a mental issue, and I believe he was on the phone call stating that his brother had this mental issue, and they took it in their matters to just go ahead and do what they were going to do to him. And it goes back to our trust issue with law enforcement. I am a Black Lives Matter activist, and I support BLM all the way. I'm pro-Black. I'm about, educating my peoples on what's right and what's wrong out here in our communities. And the thing is the people we need to build trust with them, and they need to build trust with us. And we need to all get together and make things better. Especially this medical thing. I didn't learn a lot about my medical stuff until I went to prison. Well, I went and got checkups. And then when I was doing blood work in prison, it was telling me about my iodine level. This was high because I was drinking a lot of alcohol. So I started doing some research on this stuff and started getting myself together. A lot of men don't learn about themselves until they go to prison, and I learned a lot about my health issues while I was incarcerated. Recently, while I've been out, I had some issues with heart. My heart was I was feeling like I was having a heart attack. I rushed to the hospital. Back in the day, I wouldn't have went to the hospital because Black man, we don't go to the hospital. Then I had a problem with my groin. After that, I rushed to the hospital. I was at work, and I just laid on the ground. They bitch called an ambulance. I had to go back for the checkup because of the money. I'm saying that to say that because I haven't had that problem lately, but I do need to go get a checkup because I had that issue. So it means the issue's not solved. I prayed about it, right? Ms. Dunham said, I believe in prayer. But I do need to go get a checkup and find out what the problem is and what the situation is. But that's not something that in Black community we do because we're afraid what they might say and what they might do to us. So, and then it becomes a money thing too. So, but I'm glad that now I've crossed that bridge and I've figured out the money situation and I've crossed the bridge and not being afraid to go get a checkup and see when something happens, like heart problems or you're having signs of headaches, like you were saying, your teeth it can affect a lot of things, So that's the type of knowledge we need to start teaching in our Black communities. And not just Black communities, all communities, but definitely in our Black communities.
And I'm glad you shared that. And I'm glad you overcame your fear and started going to get checkups because we definitely need more people around longer to get into the good trouble. But one of the things that I would say, like my wife and I literally use all of the education and the things we couldn't do in higher ed and the things that we couldn't do in behavioral health and created an organization to do it. So a lot of times people say, y'all just talk about love. Like, no, we talk about values because where people place their values is where people are going to place their interest, but also that determines a lot. So having simple conversations about value, some people don't think that mental health is really that important because they haven't had anybody impacted by it. So they don't even know something as simple as things that are psychosomatic. I had a psychosomatic episode. I witnessed somebody die traumatically, and my body began to take on those symptoms. Nothing was wrong with me, But because I saw it, I relived it. So when we talk about faith and we talk about belief and we talk about mental health, a lot of people don't know that something you can think or see can cause physical issues as well. But had I not seen a mental health specialist, I would have never known about those things. That is really what encouraged me actually to get in mental and behavioral health, to learn a lot about that, because the mind is very amazing and we can tell ourselves certain things and those things truly do happen in our lives. So education is important, and I'm big, and I do agree with you, with an incubator of trust. So, Adrian, I'm gonna yield it over to you because it's 7:26, and you know how I am about time. So, and then Mary can close us out. Isn't Adrian lovely in her nice bistro coffee bar?
It's just so peaceful. I figured I'd use it peaceful for this conversation. Jay, thanks for giving it to me at the end, because now I can make sure I don't go over the time talking. I'm glad we ended on that note with mental health. Mental health is something that I guess you can say I'm big on. I do have a family member that has schizophrenia, and he was continuously misdiagnosed and continuously arrested until he was diagnosed, even though, you know, we continued to tell doctors that we knew that there was something wrong. You know, he got the bipolar diagnosis, he got oppositional defiance and all those things before we, you know, finally got the schizophrenic diagnosis. So it continues to definitely be mistrust, and as well as an issue with mental health. I definitely think there needs to be a part 2, and maybe we need to discuss mental health in the next part. But I have had a wonderful time, and I'm so glad that everyone was interactive tonight, and was willing to come out and join us and just lay it all out here, because we definitely need to open up more about health as African Americans, as Black people. I'm just saying, we tend to not talk about our health, or I know someone said, you know, we pray about it, but sometimes we only pray about it and we don't go to the doctor. So I think there needs to be both. You know, your mom or somebody from church will be like, just pray about it. Well, that's great, but I think we need to pray for the doctor that's going to see us as well. So we definitely have to make sure that we're going to get checked up on and listen to our body when our body tells us something. But thank you guys.
Thanks, Adrian. This was great. I'm so glad we were able to have this conversation, and I think you're right, Adrian. We should probably continue to do this. You know, we've been having these resilient community conversations over the last few months. I feel very strongly about one thing. I think I said at the beginning, I think it's really important to support healthy outcomes is more of a concentration on economic freedom and liberation, because we heard several times, you know, Mike, you brought it up. I mean, like, there's a cost to pay. Not only the physical cost of not taking care of your health, but like, you don't want the barrier of not being able to afford it to be an issue. And I think corporate funders and individual high net worth people that are social responsible investments are thinking more about investing in healthcare in this way. You know, trying to crack the code and figuring out ways to support communities to be able to support, you know, this whole idea of like communities being the folks that come up with solutions. So working with the police as they're getting their education together, working with other institutions is really important. It's also important our communities learn and figure out ways to solve conflict without necessarily having to call the police. I don't know if that is talked about enough, because there's got to be some balance. So I think that's it. I want to thank Adrian. I want to thank Jay for having this conversation. I want to thank you guys for joining, because you didn't have to spend 90 minutes with us. Thank you for putting up with we had some technical difficulties, and we tried to make the meeting free-flowing and easy for people to access. So sometimes that brings an element that you have to fight. So I appreciate everybody doing that. And again, on our page, I will put more information about how to get access to the survey. Grace, and you and Rita for doing this project in Rockingham County. I think it's going to lead to a whole lot of great findings and just more collaboration and dovetail into the work that Katrina and the health department is doing. It's going to be focusing on Black and Brown communities. This particular project with the survey is going to be focused mostly on Black Americans, but I know the bigger project with the health department and KBR, who is a funder who thinks a lot about the social tax that we all are paying when our institutions and folks don't do the right thing. So they're thinking more about how can they support better outcomes, and I'm happy to be part of both of those projects. Paul, Portia, did you say if all hearts and minds are clear?
Now, Mary, I will say one thing though. For those who are in the Rockingham area but are or even connected, get with these incubators of education now, because we all know somebody, right, who is suffering from something. And a lot of it is the lack of resources or the lack of education, which is a resource. So this is how we begin that. Like, don't just leave the conversation, but leave the conversation with the mind of saying, I need to connect with people who can utilize this service. 3 organizations already talked about they're bridging the gap of mistrust. Let's connect with those organizations and really make sure that they support, because a lot of times that's where it falls off, right? So please connect with these organizations. Tell your cousins, your friends, your grandma, your auntie, your uncle, all of them, to really connect with these organizations so we really can make a huge impact. First in Rockingham County, and then who knows, we'll take the whole state on.
That's right. That's right. So we will exit. I do want to mention really quickly too, we are planning, and details are not yet together, but Mr. Michael Harris and Portia and some other community members, we are planning to have a Black Empowerment Week starting on February 14th, and we're going to have programming from February 14th to February 21st that cover all types of things that impact the Black community. So we're looking forward to getting that organized, and hopefully we'll see a bunch of you there. So just want to kind of throw that out there. And again, survey, if you need support or need access to it or have questions, you can reach out to NC100. The Regional Area Foundation is partnering with us as well in this project, and we can make sure that if there are any barriers or questions you have about it, we can get that information to you. And like Jay said, Health Department, Area Foundation, who else are we missing? All these folks that are doing really great things to get this information and try to weave together this network of folks. Please get in contact with them or ask questions how you can get involved and give your feedback and maybe sit at the table in some of these conversations that are happening across the county. And if you have feedback about what's working well in your county, Don, thank you for joining us from Northampton. And I know there's all types of awesome stuff happening out there. And all of our other rural communities, please share and let us know if there's things we can be doing that might work. All right. Well, we'll let you get back to your evening, and good night.
Good night.